Your first aid kit probably looks ready. The bag is there. The bandages are there. But the medications that actually make the kit functional, the ones that manage a fever, stop a wound from turning dangerous, or keep someone from dehydrating, may already be the wrong format, past their date, or one demand spike away from disappearing from every shelf near you. The medicine aisle still looks full, but the useful version goes first, and most households do not notice until they are already in the middle of a problem. Number 9. Pain relievers and fever reducers, but not the ones you think. The category does not disappear. That is what makes this tricky. During the 2022 triple-demic, when RSV, flu, and COVID hit at the same time, CVS and Walgreens both imposed purchase limits on ibuprofen and acetaminophen. But walk through the aisle and the shelves did not look empty. Adult tablets were still stacked. Name-brand boxes were still there. What was gone was children's liquid suspension. Store-brand liquid was cleared before name-brand. Infant drops disappeared before children's versions. The format gap opened fast, and most parents did not see it coming because the aisle still looked stocked. Here is where this becomes a real problem. Acetaminophen and ibuprofen are not the same medication. They have different active ingredients, different age restrictions, and different uses. Ibuprofen is not recommended for infants under 6 months. That means if a household with a young baby runs out of the right version, the adult bottle on the shelf is not a simple swap. The math involved, weight-based dosing, concentration differences between infant and children's formulations is not something most parents want to work through at midnight with a sick child and no pharmacist available. The practical move here is simple. Check your cabinet right now, not the category, the format. Do you have the version your household actually uses? Are both active ingredients covered? Check expiration dates, because liquid suspensions do not hold as long as solid tablets. Buy one extra when prices are normal, not during a spike when limits are already in place. That is the item everyone eventually thinks of. The next one is the item almost no household thinks of until they desperately need it. Number 8. Oral rehydration salts. Dehydration moves faster than most people expect. A household can have a full pantry, good food, clean water, and still have someone in serious trouble from a stomach illness that runs hard for 24 to 48 hours. Water alone does not fix this. The body loses sodium and electrolytes with vomiting and diarrhea, and replacing them requires more than fluid volume. This is especially true for young children and older adults, where dehydration risk escalates quickly. The problem is that oral rehydration products sit in a different aisle. They are near the sports drinks or the baby section, not in the medicine cabinet. Most households do not think of them as first aid. They are not on most standard emergency kit lists. And when COVID hit and hurricane seasons drove panic buying, oral rehydration products, the powder packets, the pediatric formulas, cleared from shelves before most other OTC medications because demand came from every direction at once. There is also a format issue. The useful version is not a brightly colored sports drink. WHO-grade oral rehydration formula has a specific sodium to glucose ratio designed for medical rehydration, not athletic recovery. The powder format lasts longer than premixed liquid. Store-brand powder packets, Pedialyte powder packets, Drip Drop. These are the formats to keep. The premixed bottles are convenient but less practical for storage. Check what is available in your area, buy the powder format if you can find it, and keep a supply in the kit. Dehydration is fast. The next item addresses the condition that often causes it. Number 7. Anti-diarrheal loperamide. Nobody talks about this one. It is uncomfortable to bring up, and that is exactly why households consistently run out of it. Loperamide, sold as Imodium and available as a generic, is one of the most important over-the-counter medications a household can have, and it appears on the Mayo Clinic's first aid kit list, on Pharmacy Times household stockpiling guidance, and in nearly every serious emergency preparedness resource. It is also the item almost no casual first aid kit includes. During COVID, loperamide cleared from pharmacy shelves faster than most people expected because GI distress was widespread and demand hit suddenly. Generic versions disappeared before brand name. The small foil pack travel sizes stayed because they are impractical for household use. The actual bottle, the version a household would use over several days of illness, was gone. The connection to item 8 matters. Uncontrolled diarrhea depletes the same electrolytes that oral rehydration salts are designed to replace. Without both, a manageable stomach illness can become a dehydration problem. These two items are not separate. They work as a system. Missing one weakens the other. Keep a practical size bottle of generic loperamide. Rotate it. Buy it at a normal price on a regular shopping trip, not during cold and flu season when the same shopping event that clears out cough products can also thin out the GI aisle. That handles one side of the digestive equation. The next item handles the other, and it is missing from almost every household medicine cabinet.
Number 6. Antacid and acid reducer. In a disrupted situation, people eat differently. Routines break, stress increases, sleep becomes unreliable. These are exactly the conditions that trigger acid reflux, indigestion, and heartburn. These issues affect people who do not normally deal with them and make existing digestive issues significantly worse. This is not a dramatic shortage item. That is why it disappears quietly. During COVID, store-brand calcium carbonate, the Tums generic, cleared out before name-brand rolls did. Famotidine, the H2 blocker sold as Pepcid, followed a similar pattern with generic versions thinning first. The chewable variety packs disappeared while the plain standard rolls stayed. Format again. Here is the deeper issue. Antacids are not just comfort items. Ibuprofen and aspirin, both of which appear earlier in this list, can irritate the stomach lining. Many people pair them with an antacid for that reason. If antacids are missing, the safe and effective use of the pain relievers becomes slightly more complicated. Keep both the chewable calcium carbonate and an H2 blocker like famotidine if your household uses them. Buy the generic. Keep it rotated. This is a cheap item when nobody is thinking about it. These 4 items handle pain, fever, and the GI system. The next one is what makes wounds survivable. Number 5. Topical antibiotic ointment. A small cut that gets infected in a normal situation is an inconvenience. In a situation where a pharmacy trip is difficult, it becomes a problem that grows by the day. Bacitracin and triple antibiotic ointment are cheap and easy to forget, which is why kits run low. During COVID, wound care products cleared quickly from bulk retailers and online. The small single-use tubes stayed because they are impractical for anything beyond one minor scrape. The multi-tube packs and the larger tubes, the formats actually useful for a household, went first. Some name-brand triple antibiotic formulas went through a reformulation, creating a brief availability gap in the familiar version. Here is what makes this item more important. The ointment is the chemical half of wound care. Gauze, bandages, tape, these are the physical half. Without the ointment, the bandage is just covering the wound, not protecting it from infection. Keep a multi-tube supply or a larger tube. Check whether your household has any neomycin sensitivity. Rotate it, keep it in the kit, and replace it before it is needed. That keeps minor wounds from becoming infected. The next item determines if the wound was clean to begin with. Number 4. Antiseptic solution for wound irrigation. Most household first aid kits contain hydrogen peroxide. Current wound care guidance from sources like the Mayo Clinic and the Red Cross has moved away from hydrogen peroxide as a wound irrigant because it can damage tissue and may slow healing in certain contexts. The recommended alternatives for wound irrigation are povidone iodine solution at appropriate dilution or sterile saline wound wash. Most households have neither. This is a case of outdated habits creating a quiet gap. People bought hydrogen peroxide and never updated the kit since. The bottle is still there. It looks like coverage, but the more useful version is not in the cabinet. Povidone iodine sold out rapidly during COVID and was also inconsistent during wildfire and hurricane seasons. Here is the format trap. Povidone iodine scrub solution and povidone iodine wound solution are different. Buying the scrub version for wound irrigation is a format mistake that can happen when someone grabs quickly in an aisle without reading the label. Sterile saline for wound wash is a separate item from nasal saline spray. Different concentration, different packaging, often in a different aisle. Check current first aid guidelines, stock the version that current recommendations support, and ask a pharmacist if you are unsure which format applies. The wound care chain is now complete. But the next item is where the real silent gap lives in most households. Number 3. Diphenhydramine, the right antihistamine. Diphenhydramine is one of the most versatile OTC medications available. It addresses acute allergic reactions, hives, itching from insect stings, nausea, and can support sleep. The confusion happens because people think of antihistamines and reach for whatever they already take for daily allergies. Cetirizine, Zyrtec, loratadine, Claritin, fexofenadine, Allegra. These are good medications for ongoing allergy management, but they are a different drug class with different properties in an acute situation. Most households do not know they are missing the right type because they already have something labeled antihistamine. These are good medications for ongoing allergy management, but they are a different drug class with different properties in an acute situation. Diphenhydramine works faster for sudden allergic reactions. Most households do not know they are missing the right type because they already have something labeled antihistamine. Diphenhydramine works faster for sudden allergic reactions. Most households do not know they are missing the right type because they already have something labeled antihistamine. The liquid formulation of diphenhydramine follows the same shortage pattern as other pediatric liquid medications. During the triple-demic, it became inconsistent in some areas, particularly in stores that had already been cleared of children's liquid acetaminophen and ibuprofen. A household with a young child who cannot swallow tablets may need the liquid version, and that version has the same format vulnerability as everything else in this category. One more thing. Diphenhydramine is not a substitute for epinephrine in a severe allergic reaction. That is a different emergency requiring a different response and a prescription product. But for manageable allergic reactions, a sting, contact hives, an unexpected mild reaction, having diphenhydramine available can mean handling the situation at home instead of making an urgent trip. Keep a supply of diphenhydramine specifically in the format appropriate for your household, not just a general antihistamine. That handles allergic reactions. The next two items are what prevent a first aid situation from quietly becoming something much worse, and they are the ones almost no household has right. Number 2. Hydrocortisone cream, 1%, the right strength. The medicine cabinet may already have hydrocortisone, but there is a specific strength and a specific format that matters, and when demand rises, it is not the useful version that stays on the shelf. The practical size is a 2-ounce or larger tube of plain 1% hydrocortisone. That is the format that thins first. Premium formulations with added cooling agents, aloe, or fragrance stay because they appeal to a different buyer. Plain generic 1% in a useful tube size goes first online before the product category shows any visible shortage signal. Skin reactions, contact dermatitis, insect stings, and inflammation from handling materials are common in any disrupted situation, especially if the household is spending more time outdoors or dealing with physical work. Without hydrocortisone, these manageable irritations become the low-grade, persistent discomfort that wears people down across days. And it connects to wound care. Wounds healing under bandages itch. Hydrocortisone is part of managing that irritation without disrupting the healing process. Keep a practical tube of plain 1% hydrocortisone, not 0.5%. Check the expiration date. Rotate it. Every item so far handles a specific physical problem. Number 1 is different. Number 1 is the item that quietly decides whether every other medication in the kit is safe to use or not. Number 1. Expiration date awareness and dosage reference. The most dangerous first aid kit is not an empty one. It is a neglected one that looks full. This is not a product, it is a habit. And it is the one that almost no household maintains. A kit gets assembled, stocked, stored, and then forgotten for 2, 3, sometimes 4 years. Medications expire. Liquid suspensions degrade faster than solid tablets. Children grow, and the weight-based dosing on the label becomes inaccurate. During the 2022 children's medication shortage, some households discovered that the liquid ibuprofen they did have was outdated. They had covered this gap once, they just had not maintained it. The kit existed, it did not function. Picture the scenario. There is a sick child with a high fever. It is late. The pharmacy is closed or the situation makes a trip difficult. The kit comes out. The liquid ibuprofen expired 14 months ago. The hydrocortisone tube is nearly empty. The antiseptic is the wrong type, left over from an old kit. The dosage card is missing. Everything on this list exists in that cabinet in some form. None of it is reliably usable. That is the real version of this shortage. Not always a supply chain story. Not always an empty shelf. Often, it is a kit that was built once and never touched again. The fix is simple, and it costs almost nothing. Twice a year, when the clocks change is an easy anchor, go through the kit. Check every expiration date. Replace what is expired or nearly empty before it is needed. Keep a printed dosage reference that is specific to your household's members, reviewed with a pharmacist or doctor, noting which medication is for which person and in which format. Make sure the format in the kit matches the actual need. Children's liquid versus adult tablet. 1% hydrocortisone versus 0.5%. Diphenhydramine versus a non-drowsy daily antihistamine. This is the item that makes every other item on this list either work or fail. The smartest households do not have the most dramatic supplies. They have the right supplies in the right formats, rotated and current, before the moment they are needed. A shortage does not begin when the shelf is empty. It began when your supplies expired and nobody noticed. Pick 2 items from this list and check them this week. Not all 9 at once, just 2. Add what is missing or expired to the next shopping trip at normal prices before everyone else has a reason to be looking. The question is whether it will actually work when it needs to.